I am Dr. Ramakant Deshpande, a senior cancer surgeon and also a director of the Asian Cancer Institute at the Somaiya Ayurvihar, Mumbai. This is an institution with a difference. This institute the idea was conceived, implemented, being managed by a group of cancer specialists, more than 45 cancer specialists at this juncture, which has never really happened in the past and it is not happening anywhere in the country. There are no non-medical people involved in this particular venture as of now. This is the first phase. What we are functioning is at about 80 beds, which will in the next 3 years will become a 250 bedded cancer hospital located at the same space. The reason why we did this is all these the specialists actually worked at the famous cancer hospital, the Tata Memorial Hospital, in the 80s and the 90s, established standards, created leadership, and eventually left the institution, having left behind a very capable hands, and continued to be as a group. Initially, this group conceived the Asian Institute of Oncology, as it was known then, in 2002 during the Diwali times. That was the time of conception. We functioned initially for about 6 months from the Piramal Center, the Wellspring Center. Then we moved to the Raheja Hospital from 2002 to 2013, and from 2013 currently we are functioning at the Somaiya Hospital. The difference between this hospital and the other hospitals is basically, as I mentioned, that it is a center which is totally conceived. So we are closer to the problems of the patients, their difficulties, their superstitions, and the way to implement their treatment and their rehabilitation. That's number one. Number two, we have created this institution in an asset-light modality. So our costs also are much lower. Our motto is basically excellence in cancer care at affordable cost, and that is reflected by the final pricing of the overall care that a patient receives here, as you receive absolutely top of the line care at almost 30% discount. I mean, less than any other hospital anywhere in the country, I would say that. We can't really compete with the government hospitals who subsidize, but we are definitely cheaper than any other private hospital, but with a premium kind of a treatment. So the best of the results which are there. The reason for establishing this center was to create essentially a hub and spoke model for overall cancer care. We have the hub here. We also have collaborative centers, one in Bhubaneswar in collaboration with the Amri Hospital. We are looking at other centers which are coming up now. The spoke models, basically there are two types of spokes. We realized while practicing oncology that there is a very, very large population, the bottom of the pyramid, which does not really either come for treatment because either they are ignorant, they are ill affording, or there is a superstition, or because of logistic reasons. So what we did is, actually there is a colleague of ours, medical oncology colleague, who has actually given up his practically his career in this direction, Dr. Pendharkar. So this scheme is basically known as Dr. Pendharkar Asian Cancer Institute scheme. This is a social outreach scheme where this scheme is being run in collaboration with the state governments. We have already completed Madhya Pradesh, Chhattisgarh, partly in Orissa, and partly now we have started this in Maharashtra itself. This is an absolute pro bono exercise. The Asian Cancer Institute does not really generate any revenue from this particular activity at all. The district medical officers of all these districts are actually called in for a central training center where they are oriented, where they are kind of put through a continuing medical education regarding management of cancer, diagnosis of it, and then they go back to their centers, where in their hospitals we encourage them to form a daycare kind of a center for administration of chemotherapy, where you have a trained technician and a nurse. So in collaboration with the medical officer who knows, then they will diagnose cancer patients in the close by vicinities in their own district, and these patients would probably never would have come to a cancer center earlier. Now they are getting the benefit of being diagnosed. These reports are sent to the central processing center, to our center or to Dr. Pendharkar, and there are other centers, one in Delhi, one in Madhya Pradesh. So their diagnosis is made, the provisional treatment plan is made. The closest surgeon, the cancer specialist, whoever is available, not necessarily affiliated to Asian Cancer Center, but to any other proper respect to center, is actually contacted. Their surgeries are done if required, radiation is done if required, and the chemotherapy is given in help with the state governments. In fact, we are very, very happy that the state governments have been extremely cooperative, and several crores of rupees is coming as an assistance for this particular scheme in the form of chemotherapy drugs, which are administered to these particular patients locally. So the patients who would never have gone for management of cancer are getting their treatment close to their house, in their comfort, and appropriate treatment which is possible. Now, this is the type of a scope for the socially and economically challenged patients, and this is our social commitment. We also have another spoke, which is we call a Smart Cancer Center. The first one has already been established at Lucknow, where affording patients will approach, and the same kind of knowledge spread is done through the audiovisual media about awareness of cancer, treatment of cancer. Their reports again come to the main center in Mumbai, and their diagnosis is sent, and if at all required, they are treated through the same way but at a cost. So we try to reach as many number of patients in our country as much as possible, and we are extremely happy. The governments alone cannot really do anything. You always needed private players also to get into this kind of an act. So you have the hub now in Mumbai as well as in Bhubaneswar, probably in more places to come, and you also have the spokes which are for private as well as general treatment. The challenges in achieving our goal, what we have found is we have financed these centers through our own money. So finance has never been a problem. Our growth has been very slow because it's been of word of mouth. We have not tried to really advertise. Shortage of trained personnel is one thing which we always face. You cannot really create an oncologist, be it a surgeon, be it a radiation oncologist or a medical oncologist of repute, of experience. It's not so easy to create such a specialist. Secondly, because having spent so many years in training, the expectation of a trained person immediately as soon as they come out of their MCH or DNB is that they want to taste the fruits very, very fast. So this is a bit of a problem because you need to go through a lot of grunge work, a few struggling years, which many people are not ready. That leads to a mismatch between their expertise and their expectation. So this is one problem which actually I think it needs a lot of mentoring. So the quality of professional available, I'm sure if we do a good amount of legwork, we can actually have the same asset-light model in practically every state which has adequate space for treatment. So I think it's surprisingly, in a country of 120 crores, our main bugbear is manpower. Public-private partnership, yes, that is obviously the way because the governments all over have places which were meant to be treating patients. Unfortunately, because of various reasons, they have fallen either into disrepute or disuse, and we can certainly use that. If they can be given for this kind of a venture for treatment of patients who are socially, financially challenged, then even at a minuscule cost, the Asian Cancer Institute is willing to offer its cooperation, its expertise, its experience into going into this way, and I think we can actually reach our goal of treating the maximum number of patients, offering them world-class treatment, superb treatment by experienced consultants at a very affordable cost.